And again, that's rather simplistic. You know, of formulas to be aware of, certainly the systolic blood pressure, which is 80 plus 2 times the child's age in years. That's certainly going to be important to be aware of. I mean, again, not just from a very specific question, but using. Let's know the different age groups, again, from neonate to the infant to the toddler. All right, what is a toddler? What age group is a toddler? I'm sorry? Yeah, 1 to 3, correct. What's an ectopic pregnancy?
Implantation
Outside the uterus, sure. You know, and again, let's just be familiar with the, you know, the physiology of menstruation. Let's know all the organs of pregnancy and, you know, some of the maternal changes during pregnancy. What happens to heart rate and blood pressure in pregnancy? Absolutely. What about blood volume? What does it do? Goes up significantly. And remember, with the fundus of the uterus during, of course, gestation, what is it? Remember, each centimeter is roughly equal to what part of gestation?
1 week.
1 week? You know, and of course, the different stages of labor. What's that, you know, again, a pelvic infection, where, you know, again, is that there's fevers, chills, even someone can walk in a shuffling gait because they're so painful, is that pain? Pelvic inflammatory disease. The supine hypotensive syndrome. Know the terms, you know, middle schmerz and I think, you know, in burn children, you know, why do they have a high number of burn deaths? Well, they're thin as skin, or they're thin, you know, their skin is thin. Don't they have less subcutaneous tissue as well? Okay. They have a large body surface. All those are factors. Let's be, you know, again, the pediatric assessment triangle. Let's know with pediatrics, the different the pulmonary diseases, you know, croup, epiglottitis, asthma, and obviously the treatments are pretty simple. Let's know about eclampsia, preeclampsia, or preeclampsia and eclampsia.
What did you say about the subcutaneous?
So they have less subcutaneous fat. So again, they're going to be more prone to heat loss. What is middle schmerz? Ovulation. You know, let's be aware of the anatomical, certainly the anatomical differences, such as the airway in a child, probably more so than any piece, but, you know, those anatomical differences, you know, between the adult and the child anatomy. You know, all the delivery process and, you know, if there's a prolapse cord and preeclampsia determined? I mean, we know it's the hypertension piece in pregnancy and swelling, but what's in the urine? Proteins. Okay, let's be aware to predict and estimate a child's weight in kilograms. And remember, that's the child's age in years times 2 plus 8. So remember the child, determine their weight in kilograms. It's the age of the child, times 2 plus 8. So the age times 2 plus 8, that would be their weight in kilograms. There's some questions in here on sexual assault. Certainly the fluid boluses and things. How can you estimate, what are some rules in evaluating endotracheal tube size in kids? Well, the Broslow tape, correct? Or a length-based perception. Well, you can take the patient's age in years, well, plus 16 divided by 4. How about the diameter of their little finger? The diameter of their nares, or some other rough rules. As I mentioned, the delivery process, and that's all pretty basic. Is croup a viral or bacterial infection? All right, well, let's make it viral for the test. It's viral. So what is epiglottitis? That's bacterial. That develops quickly. Right, that's going to develop quickly. Let's know defibrillation settings. What is the defibrillation setting for children? 2 joules per kilo. Okay. Yeah, 2 joules per kilo followed by 4.
Okay. If a child is poor feeding, has headaches, fevers, even a stiff neck, what could that be? Meningitis? I think we're going to do real well with this. I know we will. What's another condition that can mimic an acute exacerbation of asthma? It's not asthma, bronchiolitis, and it occurs in children that are young. What's the cause of bronchiolitis? The RSV virus? The respiratory syncytial virus? And again, as I mentioned, backing up to the newborn care, and, let's be aware of the organ, the placenta, and of course the APGAR, what's that, at 1 minute and then 5 minutes? Let's be aware of Valium and Ativan for the treatment of seizures. What's the nearest point of the child's airway? Cricoid membrane. Cricoid membrane.
again, you know, with the bulging, the sunken fontanelle, certainly be aware, again, I just say proven epiglottitis, there's a few exceptions. The phrenic nerve that we mentioned. What's meconium? Yeah, what can meconium staining though indicate? Yeah, certainly some fetal, you know, distress, demise. And remember, kids don't have MIs. Remember, you know, cardiac emergencies in children are what? Congenital? Right? They're not typically so much familial history, you know, they're congenital in nature. Oh, yeah, and let's be aware certainly of the abrupted placentae, the placenta previa, the third trimester bleeding problems. And again, the extra credit would be drug dosages. And that would be epinephrine. What's the dose of epinephrine? Okay. Is that 1/1000 or 1/10,000? All right, how about amiodarone? What's the dose? Okay, how about Adenocar?
0.1 milligrams.
Okay, how about Valium?
Depending on age, between 0.5 and 0.3.
For 0.2.
0.2 about
All right, how about glucagon? 0.1 what? Okay, how about prednisone? That's 1 milligram a kilo. How about Versed? 0.15. 0.15 milligrams a kilo. How about atropine? 0.02 milligrams a kilo. How about Benadryl? 1. All right, that's just like prednisone. They're the same, 1 milligram a kilo. How about bicarbonate? That's 1 what? Milliequivalent. How about Ativan? 0.05 milligrams a kilo. How about Narcan? 0.1. There's your extra credit. So we've got epinephrine, amiodarone,